Whiskey and whatever.
So I want to ask you about healthcare. Your healthcare solutions. We've talked about this before, and I'm not certain what you do exactly. You've gone to concierge medicine, right?
Yep.
So I heard a quote from...
You want to hear my secret?
I want to talk about insurance.
Yeah, but okay. So, but my secret to the whole insurance thing?
Yeah.
Don't get sick.
That's a good secret.
I mean, that's the way that...
I wouldn't call it a secret. I call it common sense.
Well, that's the way they've engineered the system.
Yeah, for you to get sick.
Yeah.
Do you think they're intentionally making you sick? I've got some friends that are in the conspiracy theories and the poison in the water, blah blah blah.
Yeah.
The treatment on the symptoms, but not the cure.
All the factory food.
Mm-hmm.
Yeah, it all adds up. It all adds up, and I think that it's pretty easy for somebody who's not paying attention to just fall into this too many calories, too many sugars routine that pushes their body in an unhealthy direction. And they don't even know. They don't know because they're unaware, because they're not educated, because the food triangle's upside down, because all of these forces are acting against them.
People ask me about healthcare all the time, knowing that you employ people, having employed people, what do you do, how do you handle it? So I get those questions a lot. And so the other day, somebody here at Strongbox was asking me about it because they want to hire, they can't hire, they think they can hire, but they've got the healthcare problem. Mm-hmm. They've got a family. He's self-employed, run the company. Mm-hmm. There's 4 people. They're expecting another baby. Mm-hmm. Bring somebody on. So we ended up talking about healthcare a little bit. And then I was thinking about you today, because I heard a quote from one of the insurance companies who's mad at the hospital systems. And the quote from the insurance guy, and it's a big insurance company, one that everybody recognizes. And the guy had the audacity to say he was mad with the hospitals because they were upping their rates to the insurance companies at a rate that was significantly higher than inflation. And I'm like, you son of a bitch. Like, every year you up the price on everybody with a policy 13-14%.
Oh, yeah, easily.
I think for 10 years...
They're just trying to keep up with the premium rise.
Oh, yeah, I think for 10 years straight, we'd get the new billing for all the employees every year at Talentu, and for 10 years straight, I think it went 12, 13, 14, 12.5, 13, 14, you know what I mean? We went through, it was just like always between 12 and 14% by clockwork.
Yep.
And we changed providers a couple times in that time period to just keep the same rates. Like you would with the cable company.
And that,
calling AT&T and saying, I'm going to Comcast. Keep the rate.
That process of changing providers is a giant pain and distraction. Because they don't make it, they intentionally design that system in a way that is not easy to understand.
Agreed.
They prey on choice paralysis, and they prey on just wearing you down. The point where you're just like, screw it, I'll just, whatever, that one.
Whiskey.